Welcome to the Therapy Show podcast. I'm your host, Lisa Mustard. In each episode, I interview a seasoned and knowledgeable talk therapist from the counseling world to glean valuable insights, techniques, and tools that you can apply to your practice and your life. And if you're considering a career in the counseling field or just want to hear about what it's like to be a talk therapist, then this is the podcast for you. I was super curious to learn more about this week's topic, Ketamine Assisted Psychotherapy. So I went on the hunt for the research as well as someone I could chat with about what this looks like in session. According to the article, Ketamine Assisted Psychotherapy, Patient Demographics, Clinical Data and Outcomes in 3 large practices administering ketamine with psychotherapy, which comes from the Journal of Psychoactive Drugs, they state in their abstract that currently ketamine is the only legal psychedelic medicine available to mental health providers for the treatment of emotional suffering. Over the past several years, ketamine has come into psychiatric use as an intervention for treatment-resistant depression, administered intravenously without a psychotherapeutic component. In these settings, ketamine's psychedelic effects are viewed as undesirable side effects. In contrast, we believe ketamine can benefit patients with a wide variety of diagnoses when administered with psychotherapy and using its psychedelic properties without need for IV access. Its proven safety over decades of use makes it ideal for office and supervised at-home use. The unique experience that ketamine facilitates with its biological, experiential, and psychological impacts has been tailored to optimize office-based treatment, evolving into a method that we call Ketamine Assisted Psychotherapy. This article is the first to explore ketamine-assisted psychotherapy with an analytical framework, examining 3 distinct practices that use similar methods. Here we present demographic and outcome data from 235 patients. Our findings suggest that ketamine-assisted psychotherapy is an effective method for decreasing depression and anxiety in a private practice setting, especially for older patients and those with severe symptom burden. I will link the article into this episode's show notes for sure. But today's guest, Eric Blommel, discusses how ketamine-assisted psychotherapy may accelerate the process of growth and change for people dealing with treatment-resistant depression, PTSD, anxiety, and more. He shares how he works with medication prescribers, the parameters he puts in place with his patients, and how psychedelics may actually act as a brain reboot. We hope you enjoy today's interview. I found it super, super interesting, and I hope you find it helpful as well. Hey friend, want to be more comfortable while sitting on the therapy couch? I sure did, and went looking for pants and tops that were soft, wrinkle resistant, and would match just about anything I already had in my closet. And now Zaya Active makes up about 80% of my wardrobe. Would you like to learn more? Head over to my site, lisamustard.com, and click on the Activewear tab. And don't think this is just for women. They have men's and kids' clothes too, and our family is loving the quality, and I am loving the price tags. So head over to my site to check it all out. Well, hey everyone, welcome to another episode of The Therapy Show. I'm your host, Lisa Mustard, and today I have a special guest. I know all my guests are special, but this one to me is really interesting. His name is Eric Blommel. Did I get it right?
You got it right.
Yay! All right, awesome. I'm going to let him introduce himself to everybody. So welcome to the show. Eric, I'm so excited you're here.
Oh, thanks so much, Lisa. I appreciate the opportunity. My name is Eric. I'm a therapist in private practice. My practice is called Improve Counseling LLC. I work here in Littleton, Colorado. And I don't know, what else do you want to know?
Yeah, sure. No, before, I always love to ask the question, how did you decide to become a therapist? Because you didn't come to this, you're second career, right?
Yeah, that's true. Yeah, my prior career was in IT, in the IT field. And I decided to get in this career largely because I was helped by counseling quite a bit myself.
Yeah.
And, having spent the time and the effort and the money and all that to kind of walk the path, I thought, well, now it is my obligation and my privilege to do that with others.
Very cool.
And so I wanted to be able to pass that on. And, things kind of worked out in my life timing wise to where it was a good opportunity for me to do it. And so, I went back to school back in 2010 and took the slow path to get my degree. I actually didn't get my degree until 2016. And yeah, so that's how I decided it.
Yeah. And so here you are, you're in Colorado. What do you mostly focus on? What's your specialty or specialties?
Especially so, I call myself a relationship and trauma healer.
Mm.
So I like to work a lot with couples and partners and families, and also individuals doing trauma resolution work. And I did outside of school, I did some pretty intensive training in a modality called trauma dynamics.
Mhm.
In the past, it was called CAR, containment and autonomic resolution, but I guess that was too much of a mouthful and they rebranded it as trauma dynamics.
Mhm.
And I benefited from that therapy myself. And so that was definitely something I wanted to get trained in and to be able to provide to others.
Very cool. That's really
Yeah.
neat. Thank you for sharing a little bit about yourself and your background in that. Now, today's topic is something I do not know much about. Personally, I attended a seminar a couple years ago from a psychiatrist that talked about ketamine
Yeah.
and how he was prescribing it. And I remember looking around the room and the therapists were kind of like, whoa, like we were all kind of like, wow, this is so different. This is so, I was trying to decide if people were into it or hated it. Or, just, I think that the way therapists are, we are a little slow to pick up on things until we know that there's like best practices and research backed and all that good stuff, which makes sense.
Yes.
But I would love to hear about how you use the type of therapy that you focus on with folks. It's do you call it ketamine assisted psychotherapy?
That's right. Ketamine assisted
Okay.
psychotherapy is the name.
Okay.
And yeah, just to give you a little background. So the folks that I was trained in trauma dynamics from, they have a number of contacts with the MAPS project out here in Boulder.
Mhm.
And MAPS is the multidisciplinary, I'm going to get it wrong, the psychedelic research group,
Right. Yeah.
basically. And they're the ones who have gotten approval from the government to do testing in things like MDMA with PTSD and other psychedelic drugs, psilocybin and others. And some of the folks that were involved in the trauma dynamics training also were involved either directly or indirectly with the MAPS project because the trauma resolution protocol that is used maps so well onto the sessions that involve use of psychedelics. And so that was my first introduction to the idea that, some substances might assist in this process. Because really my focus is on doing the trauma resolution stuff
Mhm.
and whatever will assist it.
Right.
And so the fact that that using substances has been shown, at least in these initial trials and so on with MDMA and whatnot, to assist, I was like, wow, this is great. This makes the process easier for clients. It's a little smoother process and so on. And then people started experimenting also with ketamine. And ketamine, as you probably already know, is unlike the other substances like MDMA and so on, it's already legal to prescribe. It's not something that requires a special new, FDA categorization or something like that. So people have started using ketamine the same way they had used things like MDMA in session. Yeah, so in broad overview, what the trauma dynamics process looks like, it's a lot like a lot of other trauma resolution modalities like, EMDR and other very popular ones and so on. Although this one is much more somatically focused. So it has a lot of it is similar to somatic experiencing for those who may be familiar with that and the
Mhm.
work of Peter Levine. There's a lot of crossover there. But in real brief overview outline, the steps go, you join with the client, just like you do with everything else, create a good working relationship, same as you would with your accountant or your attorney, I like to tell clients. Right?
Right. Yeah.
Although a little deeper, obviously.
Mhm.
And then the next step is the resourcing phase. And in the sort of strict model, there's a very particular way of doing it. It's kind of you just basically help someone build a happy place kind of thing, and you help them go there both mentally and sort of neurophysiologically to where they can really calm themselves. However, I will say that over the course of, me learning to be a therapist and other therapists that I know that have been trained in this modality, we've kind of expanded that step quite a bit in a lot of ways for a lot of people. Like, if someone has a lot more attachment issues and so on going on, or, if they were someone who has faced a lot of chronic PTSD or, what used to be called personality disorders and is now
Mhm.
being more called chronic PTSD, we spend a lot more time on that resourcing phase to really give them the tools they need to be able to manage their nervous system states, so that when we go into the deeper work, they've got the resources available to be able to tolerate it. And so, another thing that I tend to do in that resourcing phase is, like, I'll run them through a DBT group. I run DBT groups as well, just to give them the coping skills, the sort of top-down coping skills, so that if we're in the middle of a session and we're doing, we got their chest cavity wide open with trauma, that they can kind of knit it back up and go and do their daily life. All right, so then we do the resourcing. Then we work on boundaries. We work on yeses and nos, and we start checking in with the body about that already. Like, okay, what happens when you say no to me when we do this we'll do like an empty chair gestalt thing, or we'll do a role play. And, so what's it like to say no, and when people check in with their body and that kind of thing. So, and as you might expect, as with any other trauma resolution stuff, you want to make sure that the client isn't re-traumatized. So you want their no to be good and strong, right? Because as it's been said, I'm trying to remember who said it. I think it might have been Bessel van der Kolk, who said that every trauma is a boundary that got overwhelmed. So you don't want that to happen in therapy. Anyway, so I go through all this detail just to say, we build a lot of safety in the front end of doing any kind of trauma work at all, whether ketamine assisted or not. And it's not something you leap in. It's not like someone can call me on the phone and say, dude, hook me up with some ketamine, and they show up, and you know what I mean? That kind of thing.
Right, yeah.
Like, this is part of a serious, like, trauma resolution thing.
Sure.
So it's not even after we get through the yeses and nos, then we take the detailed trauma history and we rate the traumas based on what type of symptoms they promote in the person, right? So is it more like the anxiety or anger type symptoms, the kind of hot symptoms, so-called, the sympathetic nervous system? Is it like the parasympathetic, where they're more depressed and dissociated, where they kind of go, we call that like more state 4 trauma. There's various states, autonomic nervous system states. So like a state 3, we call like a dual activation state, where you're both wound up and kind of frozen, right? That state. And the state 4 is like the dissociative. And part of the reason I mentioned that right now too is, as we'll get into, it's actually the dissociative states, which are, number one, the hardest to work with unassisted, and number two, seem to respond best to the ketamine-assisted treatment, which is kind of interesting and ironic, considering that ketamine itself is classified as a dissociative anesthetic.
Right. Wow.
Right? Yeah. But we'll get into that in a minute. Yeah. So what the process looks like unassisted, to begin with, just to give you an idea, is we check in with the body and we walk a person through, if it's an experience they can remember, and not all experiences are, especially if they have very early trauma that's pre-verbal, but just giving you an idea of, let's say there's just for simplicity's sake, let's say it's a person who's generally, well-resourced, has like kind of good attachment and that sort of thing. And not that all attachment isn't good, but you understand my point.
Right.
Like,
I gotcha. I gotcha.
Generally healthy and so on, but they've had like a car accident and they got PTSD from that, right? So what we do is we'll have them, and we go through all the safety steps first, then we'll have them sit still and just check in with their body and say, okay, tell me what your body is saying. Let your body do its normal autonomic thing without you interfering, right? So a lot of times the theory goes that there's a defensive response of some kind that may have occurred during the thing. Like, you're in a car accident, you might throw up your arm to kind of, or you might make your arms straight on the steering wheel to try to hold things back, or jam your foot down on the brakes, that kind of thing. And your nervous system gets as wound up as it can get to try and respond to this threat that emerges. But, you can't respond to the threat. Your top activation level did not work in responding to the threat. So that's when your nervous system gets overwhelmed. So, but that tension is still hangs out in your body.
Right.
So what we do is then we check in with people's bodies and say, okay, instead of inhibiting whatever response that you might feel, let it happen. Like a sneeze, like a blink, like and pardon the comparison here, but like vomiting, right?
Mm-hmm.
Allow your body to do it. Instead of trying to stop it, allow it to do it. Because oftentimes what produces symptoms is that our body is trying to nag us to complete this incomplete defensive response, to dissipate the tension that was built up before the moment of overwhelm, in which it had to quickly switch nervous system states, right?
Okay.
And so we say, okay, now let your body do it. And what does that look like? Sometimes a person, let's say it was an example of their arm came up in a car accident, their arm will sort of automatically start doing this thing.
Yeah.
And then their whole body will start to shake, and they'll get tense, and they might start having a grief response and crying and tearful and that kind of thing. Right. And so that's one way then that their body can release those stuck nervous system responses that are hanging out in their nervous system.
Wow.
Okay.
Wow. Okay.
Right. And so I can say, so I don't mind admitting or disclosing that I'm a trauma survivor myself, and I've been through this therapy myself. And I'll just go ahead and say both assisted and unassisted.
Mm-hmm.
And I started off doing it unassisted. And the process, I can tell you, can be quite distressing, right? It's kind of a species of exposure therapy with regard to doing trauma resolution.
Right.
And so being re-exposed to the traumatic moment, reliving that experience autonomically, letting your nervous system get as wound up as it's going to get, at the peak of your anxiety and anger and all those things, it's quite distressing. And it can be painful, right? I mean, there's like muscle tension, and there's shaking, and there's crying and grief. And I think the comparison to vomiting isn't that bad, because you know what I mean? It can feel kind of like an emotional vomiting, like you're just getting this toxicity out of your system.
Yeah.
Right?
Yeah.
So I don't know, and it's also similar in the sense that when you're done, you feel this great relief. And guess what? Some of your symptoms start to dissipate because the stuff that was locked in your body, has dissipated.
Wow.
So again, I go through all this detail about the trauma resolution protocol and what it looks like and what it feels like and all that to set up why it's such a blessing to have the ketamine available. Because here's the thing, and again, I can tell you this from experience as a client. When you're doing the ketamine during the session, and when you're doing it during this process of releasing the stuff from the trauma, it makes it so much easier. Number one, it's a tranquilizer, right?
Mm-hmm.
It's something that calms your body, calms your nervous system, to a great degree, calms your mind. But it also is greatly resourcing. It kind of, I don't know how else to put it. It's something like, something holding your hand through the process. You've got this extra boost in your system that helps you cope with and tolerate it without inhibiting it.
Mm-hmm.
See, that's the beauty of it, is that it's not like something like alcohol or, some other kind of substances, which will actually inhibit these responses, right? We know from people that suffer from a lot of PTSD is they'll often use alcohol and things like that to calm their symptoms, to kind of suppress the anxiety and the tension they're feeling, all that. And some, soldiers and stuff I've talked to use it to try to fall asleep.
Mm-hmm.
Of course, we know that doesn't work because it inhibits REM.
Mm-hmm.
Right. But the beauty about substances like ketamine is it does not inhibit the response. What it does inhibit is your own inhibition, if that makes sense.
Sure.
Right? Your own tendency to want to suppress these symptoms and things that come up. And I want to say it's absolutely natural and expected and understandable for people to want to inhibit these things from coming up. Right? Because one of the things that we have learned as part of the trauma dynamics process is, let's say you have a trauma that's created a dissociative symptom. Well, the thing that's going to help you recover from that is actually to go back up the ramp of autonomic activation before you can go back down, right? Because the moment of overwhelm, you were at the peak of autonomic activation, and then your system was overwhelmed and it dropped down in that sort of intense parasympathetic response, that brings you into the dissociative state. Well, as you begin to heal, you start climbing back up that ramp, and your nervous system starts getting more and more activated. And this is, I think, again, the experience we see from a lot of PTSD clients, where they come in and they're like, I had this traumatic thing and now I'm feeling anxious all the time, or I'm feeling angry. I'm picking fights with everybody. And I can't sleep and I just get wound up, all the time. Well, strangely enough, that's a good sign because it's your nervous system saying, okay, let's heal from this. Let's go back up the ramp so we can go back down. But because it's so uncomfortable, we don't understand it well. Honestly, I think it's best done in the presence of someone else. And we haven't built a lot of cultural mechanisms around that in our culture to do it other than therapy.
Right. Right.
I mean, if you think of like a traditional culture, I imagine, like back in the day when we all lived in hunter-gatherer societies, the hunter or the gatherer or whatever would go out and they'd have some sort of difficult experience, maybe on the hunt. And then they'd come back and the whole village would be there and they'd be like, oh my God, I just got gored by a rhinoceros or something like that. And you know what I mean?
Right.
And everyone gathers around them and, and maybe the local shaman, takes them off into the woods with a little ayahuasca or something.
Right. Yeah.
But then they've got the support of the whole community around them. Right. Well, compare that to the example of a modern day soldier who goes, to Iraq and gets hit with an IED of some kind and comes home and nobody knows anything about it. He can't really talk about it. You know what I mean? There's limited capacity to do this kind of community processing or even processing with any one other who can understand what's going on, who can literally or figuratively hold your hand through the process.
Yeah. And then I just want to jump in and say, because I work primarily with a military branch. I mean, that's what I've been doing for the past 10 years. And also, tell me if you notice this as well. It's not so much, it's more about the stigma of seeking, like they know they want to work on it. They know they need to, but they don't want to go because they're fearful it's going to hurt their career,
Yes.
I'm constantly like fighting that stigma with the folks that I work with. So when they do finally come, it can take years for them to decide to go, years. And it's been years of them dealing with these symptoms and of their PTSD for a long time. I just wanted to say that because I'm imagining it's almost like it just gets drawn out and drawn out and drawn out because
precisely.
Yeah.
Yes. Well, and then here's the other thing is that, years of suffering from PTSD symptoms is its own trauma.
Oh gosh. Yeah.
You know what I mean? It kind of re-traumatizes people. Yes. And the fact that they come back to a society that doesn't get it, right? That's like a worldview shift thing, right? That's another traumatic trigger, as you know.
Yeah.
I have every sympathy because there's so many barriers to people re-experiencing things physiologically and to go through the healing process. There's so many barriers. I have every sympathy for people wanting to avoid it.
Yeah.
Right? It's the most miserable feeling, which is, again, the reason why I'm so excited about the possibility of something like ketamine to assist this process, because it makes it easier.
Yeah.
It lowers the barriers for people internally. And, I think it also must be admitted that as a culture, we're more apt to accept a treatment that seems more medical, that is, this isn't exactly take a pill, but you know what I mean?
Right.
That has that flavor to it a little bit, So to be able to offer a treatment like that perhaps would lower a person's barriers a little bit too. It's like, oh, okay, I went over there and I got hurt and I can come back and I can do some therapy with this medicine and that'll help me, you know what I mean? So I'm also excited from that standpoint. Again, it's not a magic cure-all. It's not a magic pill or anything like that. You still have to go through the therapeutic process. But I think it adds that extra layer to help lower the barriers for some folks.
Yeah.
Now, for some folks, it's also going to be daunting because they're like, hey, I don't want to get on this substance that used to be a street drug or that's, as many of it's been on the streets as Special K or other,
Yeah, right.
other kind of things and, used in the wild, so to speak. But, I think one of the things that helped me, again, as a client with regard to taking that, and I had some of those misgivings as well, being someone who's, I've worked in the substance use disorder realm. I spent an internship at a clinic doing that work. So I was skeptical as well. I was like, okay, do we really want to invite a potential, problematic thing into this? Aside from the fact that ketamine itself is also kind of low dependency risk type of a drug. Aside from that, doing it in the, with the discipline of doing it only in the sacred space of the therapy, or only when it's prescribed, with the overview of a prescriber and that kind of thing, I think that can help create a boundary too that helps prevent people from abusing it.
Yeah. Hey guys, so I want to tell you about a group I've created on Facebook. It's called the Talk Therapist Lounge, and it's a place where we talk therapists can find podcast guest opportunities. That's right, if you're a licensed talk therapist and you are looking to grow your reach and visibility, this group may be a place for you to start. I'm working to bring in podcast hosts who are wanting to interview licensed clinicians that can share their expertise and knowledge with their audiences. Why should you be a guest? That's a really good question. Let me tell you, people are crawling all over the internet, listening to podcasts and watching videos on mental health issues. My mission is to help spread the word about mental health treatment and help lower the stigma around mental health. And to do that, we need to get you guys out there sharing your knowledge, sharing your wisdom, and how you help people live their best lives. And it may help grow your brand and visibility and possibly help you gain new clients. I also share how to create a podcast guest one sheet and tips and ideas for getting yourself booked on shows. So will you come join us? Look for the Talk Therapist Lounge on Facebook. I hope to see you there.
Well, so that brings me back around to, so we've talked a little bit about what it looks like clinically, right? Mm-hmm. And so how that process of going through helps lower people's barriers to expressing what they need to somatically. So let's talk a little bit about the mechanics of it. What does it look like? So as you know, as a master's level therapist, you do not have any prescribing capabilities. So that's right. That's right. Not something that can happen. So not like I can prescribe it to people. Mm-hmm. So what happens is there's a relationship that I have made with various prescribers who do prescribe and believe in it and so on. And so I'll refer the client, if a client is interested, if a client is doing traumatic work with me and so on, trauma resolution work with me. I hope the work isn't traumatic. I hope.
Right. Yeah. Right. You're doing therapy. You're not re-traumatizing people. Exactly. Right. I gotcha. Exactly.
So if they're coming to work with me, then I might refer them out to like a nurse practitioner or a psychiatrist who is in favor of using ketamine, and we'll evaluate them to make sure they're appropriate for it, give them appropriate dosage in terms of their body weight and everything like that, and what the goals are. So they have the prescription, and they're given the prescription from the prescriber, independent in a sense of me. I may, refer them, but it's between them and the prescriber whether or not they're going to get prescribed and how much and so on, and when they're supposed to take it. Mm-hmm. What they could then do is they may elect to take it in session with me to assist in the process of trauma resolution. And of course, we plan this out way in advance. It's a 2-hour session versus a 1-hour session because of the effect of the drug, the amount of time it takes for the drug. The person has to agree to get a ride there and home because they're not safe to drive afterwards. And we want to give them, probably a good long, I usually say like until the next day. It's probably better not to operate any heavy machinery or drive or anything like that, just to be sure it's completely out of your system. But in practice, and again, in my own experience, it was about maybe 3 hours after taking the drug, I was pretty much back to normal.
Yeah.
That kind of thing. So, there's also a lot of safety built into that. I've got a 12-page release form that people sign to kind of go through and explains everything about ketamine and its background and its medical history and the risks. And honestly, the risks are quite low. I don't want to oversell or, obviously, this is between you and your provider, and I'm not a medical expert, and don't take this as advice, give you all the disclaimers here.
Right.
But, it's tolerated extremely, extremely well. So a little bit about the background, and there's some great books on this subject. There's a book called Ketamine for Depression by Hyde is the guy's last name. I don't have the first name in front of me right now. That goes through, he's a New Zealand psychiatrist, and it goes through a lot of the history of how ketamine has been used since it was first used. And I'm not a person with a head for dates, but I want to say it's like in the 1950s or 60s for the first time. And it goes through all the different ways that people have tried using it, and psychiatrists and physicians. And of course, the physicians have typically wanted to treat it like any other sort of drug, right? Where it's just prescribed all by itself without necessarily, without the presence of therapy or anything like that. And so they have tried every which way to do it. They have tried nasal inhalations, and that's still being used. They've tried intramuscular injections, intravenous injections, over the course of days, like a drip for a long period of time, higher doses, lower doses. The modality that I recommend for use in the treatments that I've done is with a sublingual tab, to where they have like a lozenge, they put it under their tongue. And that's a relatively low dose. We want to start with the lowest possible dose and move up if needed. But as you know, there's also clinics out there now who do the like intramuscular or intravenous injection route. And those clinics have popped up for people who have treatment-resistant depression. So just to put that in context too, one of the things that's been found is that people with really intense treatment-resistant depression, if they're given a relatively higher dose of ketamine, it can make a switch somehow. It can do something to take care of them. One of the most dramatic anecdotal tales I've seen about this was in an article, I think it was in, I'm going to get it wrong, it might have been in the New York Times. Anyway, you can look up, there's lots of articles about the use of ketamine. But there was one young man who had treatment-resistant depression. He tried everything. He even tried the temporal magnetic stimulation. That didn't work for him. He tried this, and he was very suicidal. It's one of the parts of the features of the depression that he had. And after getting one of these ketamine infusions, he said it was like the suicide switch went off. I was still depressed, but I no longer felt suicidal, and it really felt like a switch was flipped.
Wow.
And so some people have experienced really dramatic results in that way. Other folks, and this is again with just the medication only, they may have gotten 4, 5, 6 treatments. They may, get like one treatment once and then another one 3 months later, and they feel better, and they kind of get a number of them over a period of time. And it eventually seems to kind of knock out the depression, or at least knock out the intense severity thereof. So that's been the experience with regard to, doing medication only with no therapy associated with it. Now, my thought on this subject, and again, I'm not a psychiatrist, I'm only a master's level counselor and so on, but as seems to be emerging in the research about psychedelics and so on, and you and I, when we spoke on the phone briefly, we talked about that book by Michael Pollan.
Yeah.
One of the things he talks about in that book with regard to psychedelics is the research seems to show that taking psychedelics can disrupt what's known as your default mode network, or to put simply, like your ordinary way of thinking, your ordinary neurological function. It sort of scrambles it a little bit, and it allows it to make some connections that it wouldn't ordinarily make, as well as sort of, reset. Like it's been compared to rebooting a computer.
Yeah. I think this is fascinating. I know I've been reading a lot about this idea as well, and I'm fascinated by it. My husband is as well, and he knows more about it than I do. And honestly, that's kind of what got me more curious about the MAPS program and ketamine, and is this idea of this reboot. And the way, I don't remember who describes it this way, but it's like our brains are wired to go down a certain path. Like we default to a certain path. And when we use the substances, and it could be the MDMA or the ketamine, you're just talking to me who's just like throwing stuff out there. You would know better, but it almost like covers up those tracks and gives us a new one or something to that effect. Have you heard that as well? Like, am I making that up? I don't know.
Well, or the other thing I've heard is that it takes those tracks and it sort of cross wires them, or it kind of, because of the scrambling effect, it makes connections between tracks that previously were disconnected.
Right.
It's funny, in the book by Michael Pollan, he talks about how one of the researchers has compared this process to like what kids go through. So the suggestion was when you're a kid, your brain is very interconnected. It's very kind of like disorganizedly interconnected all over the place. And as you begin to learn things, as we know about like languages, like the process of learning language is the process of pruning away parts you don't need, right? So similarly with behavioral pathways, it's similar. You learn different things and you kind of, your behavior and your thinking kind of gets narrower and narrower, honestly, as you get more and more specialized in things. You make more and more decisions, right? The root of decision is Latin caedere, to cut, right? So the more decisions you make, the more you go down a certain path. Well, so what happens with the psychedelics and the other substances is if it disrupts the default mode network, it kind of brings you back to this almost like childlike state. But but also the suggestion was that kids are, if they're always in that state, it's like they're always tripping. And so, which explains so much, right? If you have kids.
Dude, right now.
Like my partner and I were looking at my daughter, at that time she was 4 years old when I read the book, and like she started doing her thing and, being her 4-year-old self. And my partner and I would just look at each other and like tripping.
Yep.
Like,
totally. Totally. Even at like age 9, I think that's still happening, really, It's still happening. And I'm seeing a lot of it now too, because we are as we record this, we're like in the throes of the stay at home self-isolation. So my kids are home right now, homeschooling. And I'm just like, I'm in awe, like of just, well, of a lot of things, but just watching them and helping them learn and helping them stay focused. And it's just fascinating. So I can totally see that. This has been such an amazing and interesting interview. I need to get that book and I need to learn more. Do you think you would go and get that psychedelic assisted psychotherapy training eventually? Because you're not going through like a certification. I know the MAPS folks recommend, for therapists down the road, if we want to work with this MDMA and PTSD, we need to have a certification. They highly recommend it. Is that something that interests you or?
Yeah, it does interest me. And, in fact, as a sort of early adopter of ketamine assisted therapy, I'd like to be part of the training. I'd like to, help inform it and so on. That's something that I'd like to do down the road. So right now I belong to a group of colleagues who do this stuff as well. And we're kind of like, slowly developing our protocols and, methods through this and that kind of thing. And something that we hope to eventually, codify and maybe turn into official training programs, possibly in association with people like MAPS, or others.
Yeah.
I know that there are some medical-oriented trainings. There's a colleague of mine that did a training out in California, using the intramuscular injection route, adding psychotherapy with that kind of thing. But the type that we're doing right now, I'm not aware of any specific training that exists now. And again, for me, it's just been in the context of doing the trauma dynamics work and just adding this in to help ease the process for the clients.
Yeah.
And, back to my motivation for becoming a therapist in the first place. I mean, my reason for wanting to do that is because it made the process so much easier for me.
Right.
And I had lasting results from it. And I thought it was fantastic. And so I was like, okay, I want to be able to offer this to my clients as well, because it makes it so much easier.
Yeah. And I know, because I looked into the MAPS protocol for training therapists to become certified. And one of the qualifications is you have to actually go through it yourself. I believe that's part of the training I think that would make the most sense. You have to understand what it does to the body and to the mind. And I think that's wise for sure. You've shared so much really amazing information today. If people want to connect with you and they want to learn more, do you do consulting work or do you connect with other therapists, that kind of stuff?
Yeah, absolutely. Just, have them reach out. My website is improvecounseling.com. And my email is eric@improvecounseling.com. Happy to talk with anybody about this subject. And if they're local, I'll be happy to consult with them. Obviously, I'm only licensed in Colorado at this time.
Right.
Yeah.
Okay. Well, we'll definitely put all that in the show notes. So if folks want to reach out and connect with you, I hope you guys do, because it's funny how you and I connected. I think I was asking in a group who knew somebody who did this, and then somebody recommended you. And I was like, I'm just going to email this guy. And it turned out to be great. So guys, don't be afraid to reach out to Eric. He's very helpful, and he has a passion for this. It's evident, just so much knowledge and experience. And I'm grateful that you are doing this, because it's going to help so many people. And, I say it a lot. Our patients, our clients are going to hear about it, and they're going to come ask us therapists about what do we know about it. So we need to know enough that we can advise them, and
Yeah.
based on their situations and their issues, if it makes sense for them. So thank you so much for coming onto the show and sharing your wisdom and value. I really appreciate it, Eric.
Oh, absolutely. Thank you so much for the opportunity.
Thank you so much.
Thank you, Lisa.
Well, that wraps up another episode of The Therapy Show with Lisa Mustard. I know there are hundreds of thousands of podcasts out there, and I'm thankful you've chosen to listen to mine. Be sure to visit lisamustard.com to access the show notes and discover more fantastic content. And I'd be grateful if you subscribe to the show. Thank you.